Same thing with topic selection. It should start with the passion. What are you passionate about? What are you passionate about? Okay, somebody mentioned the paper, the topic. Yeah, I like it. Sindhura, I like your topic. I don't want to deliberately mention it because I wanted to just the students who are right now live should know, not everyone else. Because I'm keeping this video so that you can watch it again. It will remain here. Ideally, only your group members and your CIBNP fellow members should be able to know your topic. That's it. And by the way, now, so topic selection, the main goal, the main theme is the passion, and you know this now. Now, the second thing all of you need to do is remember the reason we cannot select topic is because we have forgotten to read. We don't read enough. How many times do you read the books on medicine? Do you read articles on medicine? Do you read magazines on medicine? Do you know there are so many magazines related to healthcare? If you're living in the US and you haven't, and you're a doctor and you haven't, then you're wasting your life, you're wasting your time. Subconsciously, just when you have a magazine subscription at home related to medicine, for example, and you are doing breakfast and you're just reading, oh, just by looking at the images, you learn so much, you can't even imagine how much you learn. And when you read something, you learn something more, you get more ideas. Remember, the ideas always come to the mind that is occupied learning, that is occupied in reading. Are you reading enough? I know, because of the when you open your first aid book, when you open your Kaplan, when you open your Pathoma, you some of you get scared. Only few of you enjoy, but most of you get scared. Most of you get stressed out of it, and the main reason is that if that is the thing that is happening, that you selected your topic, I mean your field, because of somebody else. You did not select it because of you yourself. So that is the main reason. And secondly, the reason is, if you still think that this is your passion and you enjoy clinics when you are in the hospital, it is also possible. Then why are the books giving you fear and anxiety and stress? Because you haven't developed the habit of learning. You have developed a habit of fear from books. So learn audio wise, learn the subject in audio mode. Listen to Dr. Najib's lectures. Listen to Dr. Sattar's videos, audios, Pathoma videos. Listen to people, Dr. Mubin's lectures. Great teachers, wonderful teachers. Everyone knows these names, right? Legends in the field. Listen to their lectures in medicine, and on YouTube you have plenty of videos available. You can learn audio and video wise. You can finish learning from books. You can just rely on videos and audios, and you will see that you still love it. You will see that you still love it. So sometimes the fear is only of the books, not the field itself, but the books. That's why I personally believe that USMLE exam should be audio and video in nature in the future, especially for, it should be given, you should be given an option. You want to do a written test or you want to go do an audio and video test. That's what I believe, because many people are audio and visual learners, and they can perform better at a test when it's audio and video, rather than reading the whole one page question bank, or the stem, reading the whole long stem. It's a very difficult task for some people, especially somebody who has ADHD or who has some focus problem. It will be a tough thing to do. That's why I'm a huge supporter of audio and visual learning and visual and audio exams. So it is also possible, what I was saying actually is, it is possible that you really love the field, but you just don't like the book. So change your learning style and start enjoying the videos and audios on YouTube and different sources. And if books are the ones that scare you, then magazines don't scare you. Yeah, right? You guys enjoy magazines. When we all were young, we used to read children magazine, and we used to enjoy pictures and images in the magazines. Magazines are very pictorial. Magazines are very visual. So magazines provide you that learning that you had never imagined. So can you try that? Can you try that? Try to get magazines, health-related magazine, health or medicine-related magazines. If you go to any store, if you are in the US and you go to Walmart or any store, they have a magazine section. Go and grab a health-related magazine and start reading about the diseases. You will see what is in the news. You will see what is popular nowadays, and this will give you ideas for topic selection. So write down now, point number one for topic selection, passion. There's no question about it. Topic selection should be passion related. How do you identify passion? Something that you love the most, something that gives you happiness, something that makes you happy. When you think about it, you feel happy. You feel energetic, something you cannot get tired of. You keep doing it again and again and you cannot get tired. That's a sign of passion. That is a sign of passion. If you have completed your sleep, that's very important to understand. If you have completed your 7 to 8 hours of sleep and you're doing your passion, you can do it non-stop until the next sleeping time comes in. Yes, so now the question is, how can I know the topic I selected will be good for publication as I don't have much experience in the field? This is what we are discussing today. So number one point is clear passion. You will identify what you're passionate about. You combine two things together. Point number two, you combine two things together. Like one of my papers was psoriasis and depression. I combined a skin problem with a mental problem. Depression and psoriasis, I combined them together and looked at the association, why they are associated, why they are linked together. One of the papers I wrote was schizophrenia and occipital lobe, schizophrenia and parietal lobe. These are the topics that I have written, I have worked on before. So what did I do? I combined two things together, a disease and a body part, or a disease and a disease. This is how you write a topic. So think about two diseases of the same system or two diseases of different systems. A disease related to, for example, Alzheimer's disease and skin problems, or Alzheimer's disease and psoriasis, or Parkinson's disease and cardiomyopathy. How are they associated? Are they associated at all or not? So you come up with 4 or 5 of these options. 4 or 5. I would say give yourself 5 options, combining things together, and now do a scoping search. Now do a scoping search and see what is available, how much is available. If you can find plenty of articles published in the last 5 years, maybe 100 articles in the last 5 years, you have hit a jackpot. That means this is topics. Select 5 possible topics. Point number 3 is select 5 possible topics. By combining two things together, and one by one look at every article in the databases such as PubMed. PubMed is the main thing. Search on PubMed and see how many articles are available in last 5 years. If there are 100 articles available minimum in last 5 years, that's a wonderful topic. If only 10 articles are available in the last 5 years, not a good topic to write a traditional review or even a systematic review. Try your level best to write a systematic review or traditional review about something that can give you minimum 25 and maximum 100 plus articles. But I'm giving you a standard. In last 5 years, you should have at least 100 papers. That's why we always give ourselves 5 possible topics. That's why we always give ourselves 5 possible topics. That's very important to understand. I want everyone to understand this. 5 possible topics. Don't just choose one topic and think my topic selection is done and I'm a hero, I have a topic. No, nobody knows. Even if I plan to write a review article now or a systematic review, I will not be sure if the topic I have selected will have enough data. Nobody knows, right? We don't know how much data is available. So that's why it's ideal to select 5 possibilities, 5 possible topics. You search your topic number 1, how much data is available. If not enough data is available, only 10, 20 articles are available in the last 5 years. Or overall, just 20 articles, don't do that. Try to write an article where you have at least 100 articles in the last 5 years. It will be easier for you to write. Although I'm that experienced, guys, I can write a review article even if I have 20 papers available. I can do it. But since you guys are new, I would recommend start like this, at minimum 100 articles in last 5 years. And if you feel that yes, there are 20 articles available, they exactly talk about the same topic that I'm looking for, and there's a lot of information available, then you can write an article. I wrote an article, a traditional review with 27 references. Another article I was writing about was just had 12 references. But you are new, so your goal is 100 articles in the last 5 years. 100 articles in the last 5 years. So now, the next thing about topic selection is reading, write it down, reading. Develop a habit of reading. Develop the habit of reading. How much time do you spend reading in the medicine books? If you are not reading enough, you will not be able to get more ideas. The problem that we don't have ideas for research is we are not reading enough. We're not reading enough books. We're not reading enough research articles. Can you read other people's papers that have been published recently? Can you just read like 4 or 5 papers a day? Just quickly, just skim through them. Just the abstract of just 5 to 10 papers every day. Can't you just look at 5 to 10 references, abstracts every day? Everyone can. This will give you a lot of ideas what you can focus on. If you say that I don't have ideas and I have been into this training for so long, although it's very rare, but if let's say you are among those rarest candidates who say that I have been in this training for past 3 weeks now and I haven't selected a topic, that means you have messed up. You have messed up. That means you haven't read other people's papers. That means you haven't read the medicine books. That means you haven't read the magazines. That means you haven't read the blogs lately. And that means you're not watching enough YouTube videos related to medicine. You have to learn to think. And thinking capacity for ideas come from reading. How much are you reading? There is plenty of knowledge available in the world. There's plenty of knowledge available in the world right now. It's just the problem is people don't read enough. And then once you read, take notes and think on paper. Think on paper. Remember, nobody should think without a paper. Thinking without a paper is just waste of time. Thinking without a paper is just waste of time. If you really want to think and excel, you should think on paper. That idea number 1, idea number 2, idea number 3, idea number 4, idea number 5.